We are ready to get started with our second panel that is centered on the question, what does an inclusive waterfront mean to you? So I'd like to introduce our panelists, Reverend Willie Bodrick, President and CEO at the American City Coalition, Jenn Meakem, Community Engagement Specialist at Boston Harbor Now, Ina Ming, Director of Small Steps Project with We Got Us, and Harvard Med student, and Dr. Jon Santiago, State Representative, 9th Suffolk. And our moderator, James Hills, host of Java with Jimmy. Give it up for our panelists.
Good afternoon. Can you hear me? We're good? I don't have to turn anything on? Okay. You want to test your mics first to make sure we're all good? There's a tech side of me that just wants to help the tech folks out in the back, so we're good. Say good morning.
Good morning.
Good morning.
Good morning.
We're all set. So we're here today to talk about the perspective of inclusion. And it's so interesting because the fact that we have to have the conversation about inclusion means that there is a sentiment, a practice, an action, an active thing going on that is changing, but at some point people feel that they have not been included. And so we're going to go there. I have my notes electronically, so I'm not on my phone. I'm actually just making sure that we cover everything that we can and get a lot of conversation going and really hear different perspectives when we talk about inclusion. So there are a lot of factors that lead to exclusive and inaccessibility on the waterfront, different places in Boston, the world. How do we make sure that people have access to the waterfront but also feel welcome there? And I'm going to start from left to right, and we'll start with my good friend and brother, Reverend Willie Bodrick. Give him a hand.
Good morning. Thank you, Jimmy, for moderating this, and thank you to each and every one of you who are here. As we begin this conversation, it starts as we consider equity and ownership. Who feels as if they have access to the spaces that are created in Boston? And one of the things that we always talk about is shared prosperity. When you think about the waterfront, you can look at the demographics. Except for East Boston, the median income is about $107,000 on the waterfront, juxtaposed to communities like Roxbury and Dorchester, where you see stark differences. And so when you think about inaccessibility, you also think about who has ownership in the space, who feels that they own the waterfront, and why that is such a difficulty. One of the things that we've been doing at the American City Coalition, and much celebration to the work of my colleague Charlotte Rice, who's here today, who deserves a hand clap. Around 2018, we started the Waterways program. And this program was really focused on ensuring that Roxbury and Dorchester residents had access and to be engaged in the work of having a sense of ownership of this waterfront that's not just belonging to Seaport, but to all of Boston and to all of Boston's residents. And one of the things that we were doing, which is a part of the logic model of the work that we do, is having resident identified barriers, right? The discomfort that they feel, the experiences of discrimination that people reported back, the lack of feeling as if it is not easily navigable in the space, and ensuring that there were people that look like them when they go out there, right? And so one of the pieces that we've identified is that the experience of the waterfront has not readily been accessible to those who live in our neighborhood, and we've been working fervently. We've been doing the Joy of Kayak, and we've been doing other programming. We did the boat ride, and we're partners at Boston Harbor Now. We've been working continually to try to work to not only create an experience of exposure, but an experience of shared ownership and shared prosperity. And there's so much more work to do. We have to really think critically about the next steps of that, because it can't stop at just bringing people to the waterfront. That's just surface level work. But what we're talking about is employment. What we're talking about is shared economies. What we're talking about is parallel investments. And that not only are we going to the community and sharing the waterfront, but when people come back home, that they can see that same investment made in their community as well. And so I think those community identified barriers around the discomfort, around the inaccessibility through capital and means of accessing spaces that should look comfortable for people, and also just the opportunity to make sure that they feel that this space is theirs is a part of the work of that I think everyone here is engaged in to make sure that the barriers are reduced and the opportunity is increased.
Thank you for that. It's sort of an affirmation to me that to say that I'm going to basically stay with the part where you name some things around the barriers. And I want to just talk for maybe about 2 minutes, and all of us can jump in. All of you can jump in here. But what are some of the factors that led to what you talked about, not having shared ownership, not feeling welcome? What are some of the factors? And anyone can sort of jump in here on this piece for a couple of seconds, because let's name how we got there. We're switching places, but let's name how we got to where we're trying to get away from. Anyone?
Well, I think a couple things, and good morning, everyone. Jon Santiago here. It's great to be here with this group of esteemed panelists and my friend Jenn Meakem. And thank you to the organization for putting together this important conversation. Let me just state emphatically that your zip code should not determine whether you have access or not to the waterfront.
Say that again? Your zip code doesn't or does?
Should not determine.
Or should not? Yep.
Yeah.
Yep.
Let me say it again here. That your zip code should not determine whether you have access to the waterfront or not. And I think when we talk about our society, our city, this Commonwealth, it's not just a waterfront. There have been multiple groups who have been excluded from the voting booth, from access to health care, from from a whole host of issues. And so when I see my work as a physician in the emergency department, for me, it's troubling to see this and take note of the different sectors that are connected here. So when I talk about access to the waterfront, to me that's related to access to education, economic opportunity. When I take care of someone who's been assaulted in the emergency department, whether it's a gunshot victim or not, after a couple of times, these patterns become, they stick with me, right? It's the same young person from Roxbury, Dorchester, who lack the economic, educational benefits, right? And so when we talk about access to the waterfront, for me, that relationship between access to economic, educational opportunities, they're all the same here. So fighting for the waterfront also means fighting for those same things as well.
So you would say the barrier is not just access, but a lot of here's something you would appreciate, Dr. Senator Santiago. Rep. Okay, maybe. I'm going to get in trouble up here. I don't want to get in trouble up here. Social determinants of health are a factor that are a barrier to access to the waterfront. Jen or Ian?
Well, let me just add real quickly.
Yeah.
But you're exactly right. Health outcomes are so much determined by these social determinants of health. But we have to ask ourselves, what determines these social determinants of health? I would argue that the political determinants of health determine that, right? So who's in office, who's fighting for certain pieces of legislation, who's including groups that are not typically participating in these discussions. That's what determines those social determinants of health, which further subsequently determine the health outcomes or lack of access to the waterfront in this case.
Gotcha. Jen, and then I'll come to the Reverend.
Yeah, thanks everyone for being here today. I'm Jen. I would say a couple basic ones that have been talked around, but transportation to and from the waterfront, a huge deal, especially if you are in a zip code that doesn't as predominantly have access to the waterfront. Another is activities on the waterfront. If you're going with your friends, if you're going with families, what is there to do there? Another is food. Can you actually afford the food that is on the waterfront, right? If you are going to spend a day there, if you have to travel a farther way, right, take 2 trains and a buses to get to the waterfront, will you have food that you can afford to eat there? Those are a few that I think are definitely barriers.
Yeah, thank you guys so much for being here. My name's Ina. That's right. I'm a medical student at Harvard, and then I was also, some of you guys, I think I saw you guys come over and do some acupressure and some sound healing. For me, I think the notion of inclusivity really is rooted in the sense of belonging, right? And belonging is often a huge part of belonging in a place is the idea of if you feel comfortable, if you feel healthy, if you feel happy in a place. And sort of the work I think that a lot of us do is loosely tied to this idea of wellness. And for me, one of the things that I really fight for is access to different types of healing. So not only, right, I really believe health equity is probably the biggest healthcare challenge of our time. I think the pandemic has made that incredibly clear. And it's about access and not necessarily the medications or the technologies that exist. Because they can exist, but if you don't have access to it, then that's where all the problems sort of arise. But it's not just access to Western medicine. It's also access to things like acupuncture or meditation, things that we know can help a lot with chronic conditions or stress, anxiety, and especially we're also obviously going through an opioid crisis, and in our neighbors, right, at Mass and Cass are going through those issues with substance use and mental health. We can't be ignoring that, and we can't keep sort of throwing pills at people when those don't work necessarily for chronic conditions. And so one of the things that we've been fighting for, and we're really grateful to share this space, is that access to like acupuncture and healing, holistic healing, because I think that makes you feel like you're healthy in a space. And one of the biggest things too is making sure that it's free access. And so we pay our practitioners and making sure that the community work isn't seen as anything lesser than like private practice.
Yes.
So we pay our practitioners, but then they don't have to charge our community members, and the community members receive all the treatments for free. Yeah.
Pastor, and we're going to spend a few minutes talking about health and mental health and the relationship that we've often talked about with the coalition and other entities. There is benefit to access to water, and I want to throw a policy thing out there too. Pastor.
I just want to go back because you asked how did we get here, and I think all of my colleagues pointed towards it, but there's something more explicit. There were intentional land use decisions that were made.
Yes.
There were intentional structural racist decisions that were made. There were intentional decisions that were made to create barriers, not just the barriers that were outcomes like transportation barriers, other things, but physical barriers. Like the structures are intimidating to be in the space, not even just for folks who are not from the community, but even folks that work there sometimes, right? And so I think we have to be very honest about why this happened if we're going to fix how we're going to create shared equity. And I think if we're not having a conversation around structural racism and around the intentionality of building spaces that were not meant to include everybody, then we're not having an honest conversation at all, and the work we're doing is not seriously going to change the outcomes of what we want to see.
So Pastor Bodrick and I are good friends, and I've never, ever heard someone talk from the context about structural racism and how he just brought up the fact that the structures themselves could have been driven by, well, you're saying they were driven by racism, the intimidation of the actual structure or design of the seaport. I've never sort of had that consideration before. That can be a mental health impact. Let's talk about the benefits of having access to the waterfront and including everyone, and including the notion of routine and preventative health care, which includes behavioral health, mental health. They're all undersold. I'm sure Dr. Santiago, maybe you can kick this off, would agree that from the clean air to walking, let's talk about health and mental health.
Yeah. So who here in the crowd relied on green space during the pandemic, those early days? I mean, I think it's safe to say if we had access to it, and I say if because not everyone has access to green space, so many of us relied on it. I think about myself, the early days of the pandemic, working not just in the legislature, but in the ER, I needed those breaks. I needed to go for a jog. I needed to spend time in the park with my family just to get away from the tragedy that we were witnessing in the ER, but in our communities. But that green space also has similar benefits to the blue space, the waterfront, if you will, right? And so if you look at the evidence as a scientist or as a physician or just as a layperson, you will find evidence that suggests and states that people who have access to blue space, if you will, they have...
Can I interrupt for 1 second?
Sure.
Because it may be somebody, I had to think for a second. Define blue space.
Areas close to the water.
Gotcha.
Right?
Thank you.
Be it a lake, the waterfront, what have you. That you would have decreased health outcomes with respect to mental health, less likely to be depressed. It's associated with more physical, somatic aspects, less likely to be obese as well. So there are a range of health issues that will be benefited from having access to places like the waterfront.
Jenn, tell me one time where there was inclusion and you saw maybe a young person you saw them just like light up when they discovered something or something like that. I'm sure you have a couple of examples. That's why I was comfortable asking.
Yeah, thanks. I do. I think this summer we ran a series of programming at Carson Beach and also run a lot of programs with partners here. And I met a 6-year-old boy named Henry, absolutely adorable. And he came to a series of like 5 events all in a row. So I saw him every week for like a month and a half. And by the 3rd week, we had been talking every time, and we just sat down, we're eating popsicles, and I was like, well, Henry, what do you think? Like, did you like the programs? What do you think was good? And he gave me a rundown on like which activities were best and like what the best catering was and what we should do more of. And I think that opportunities like that where someone gets to come back and return and keep coming back, and then as a 6-year-old have a stake in like, no, I want like more of this, or we should have bubbles, or like popsicles are great. Like those are small, really tangible things that we can give the power to like small children and youth to make some of those decisions on what they want. And that's like part of why it's so important to not just have people have one surface experience with the waterfront, but to be able to return in so many different ways.
Pastor, I'm going to ask you to end sort of this piece out around mental health. Dr. Ina, you talked about, being open beyond Western medicine. And we're talking about mental health, and meditation and yoga and things have become such a buzzword that, one, we got to make sure folks are doing it right. Two, where is the real value, if you will, around being open to what value comes to being open to different perspectives around medicine? And you can fluctuate between sort of the physical body and the mental health aspect.
No, that's such a generous question. Thank you. I think, there's the idea of wellness is certainly, I think the New York Times came out with an article a couple of months ago talking about the wellness industry and saying it's like a multi-million-dollar industry now, right? People know that you can get green juice or get acupuncture for like $120 or $300. And I think for me, seeing how much of wellness has become commodified is quite sad. Because personally, so I come to this space from sort of 2 different angles. My grandmother was a Chinese medicine practitioner. And for her, like the most that she would ever accept from her patients would be produce or food that they would cook for her. This was a medicine that was not supposed to be commodified.
Yep.
And then in my second hat, so I'm also training to be a historian, and I've worked a long time with this particular doctor out in Oakland. His name's Dr. Tolbert Small. He was a physician with the Black Panther Party in 1968 to 1972. And he worked out in Oakland, and he worked with, the sort of the big heads of the Panther Party, Bobby Seale, Huey Newton. And he also learned acupuncture in 1972. And he was doing pro bono work. And he was inspired by the barefoot doctors in China, which they were doing a lot of like Western medicine and Chinese medicine and going to rural communities and bringing all that healthcare for free. So one of the things I love about the waterfront and the idea that you guys have is bringing a lot of services to the people instead of having people having to go places, because that's a huge model that the Panthers used, where you pop up at places, you go
like
to
being here today.
you go to communities rather than ask people to come to you, because it's exposure, and it's also they feel like they are deserving of care, which I think in a time like this, a lot of people feel like they're not deserving of care. But yeah, I have so many thoughts around this, but the biggest thing is as holistic healing, as wellness is increasing as a industry, I think we have to be really diligent to know where the roots come from and making sure that they don't become commodified, because so much of this is just like self-empowerment and self-care. Some of you guys, I think, got the points in the ears. That's something anyone can learn, really. And then you just put it in your ears, and it's not going to treat appendicitis. It's not going to treat pancreatitis, but it's going to treat some, like some stress and migraines. I think the notion of knowing that your body is a source of healing itself and that you can actually do it for yourself, I think is sort of return some of that agency to patients in a time where I think a lot of patients don't feel empowered.
You set You said some things. That was a generous answer, similar to the question, but you set some things up because I was intentional about asking Reverend Bodrick to sort of close us out from this mental health or health piece. We talked about social determinants of health. You talked about the wellness industry being commodified. Typically, when there are things made available to communities of color, when they have to be paid for, there's usually an issue taking advantage of those services. And so I'm going to ask another generous question of our good preacher here. Can you speak to how, either a little bit of how not including impacts the mental health, and then what are the benefits of including Black and brown folks on the waterfront, policy, having fun, learning different type of medicines? What is the benefit of inclusion when we're talking in this context of health and wellness with access to green and blue space? It just sounded mute. The blue space. Go ahead, sir.
Yeah, I was thinking about how I was going to answer this question.
Generously.
So I will answer generously. First and foremost, I think there's a conversation that we need to have in Boston around the erasure of narratives. And when we talk about the erasure of narratives, you also have to talk about the erasure of people from spaces. And so I think, one of the hard parts that we're having to do in this conversation is we're trying to rewrite a narrative without acknowledging the erasure that's already happened. And so when we're thinking about health and wellness, we also have to talk about the affirming of people's stories in this city and affirming who they are, what they've been. It's not like the waterfront is new to people in Roxbury and Dorchester. We know about the waterfront. It's not that. It's that there have been many of narratives that people in this neighborhood could tell you about why they did not go. There's a reason why they went in South Boston. We ain't got to tell that story all day, do we? Right? I mean, let's be honest about these conversations. And so it's not that the conversations are about us trying to get folks out there. There's been a history of people not feeling welcomed overtly and covertly to these spaces. The second thing when we're talking about wellness and health and healing, and we're talking about mental wellness, that we've talked about social determinants of health, so I won't belabor that. But we also need to think critically about opportunities in these spaces and what that brings about for the wellness of a person and for a family, right? The jobs in that area are not filled with people of color in them. And so when we're talking about exposing people to these spaces, we also need to be talking to the CEOs and talking to the folks who are running companies and businesses and restaurants in the area about why does it not look reflective of the city of Boston. And so really this work that we're doing is a question around what story do we want to tell the nation about us? Who do we want Boston to be? And if we're going to be serious about this work and we're serious about the waterfront, we want Seaport, South Boston, East Boston to be reflective of the city of Boston. So that's the benefit, right? That we have an opportunity to make the city reflective of our communities, of the great diversity, but also we get an opportunity to revive the stories that have been erased. And what I hope we don't do is try to tell a new story without acknowledging the past stories that got us here. And so I think for mental health and for wholeness, from a pulpit to a president's position, whatever it is, right? It's about affirming the real lived experiences of people and not gaslighting them to make them believe that what they've experienced was not real and that this is a new dawn and a new day of a new opportunity when they've had generations. I got people in our church, people in our community who've been here for a long time that won't step foot in South Boston to this day. There's a reason why. We have to acknowledge that. We have to work to heal from that. And we have to make sure that our programming, our actions, our work is undergirded with that understanding and that reasoning. And I think we can get to a better place where green and blue spaces are healing for all of Bostonians.
Pastor, thank you. And you all are...
Can I add something real quick, Jimmy?
Yes.
And we also have to take into account that this is going on in the context of a mental health crisis, right? There's a pandemic with respect to mental health. I'm going to work a shift tonight in the emergency department from 11 p.m. to 7 a.m. And I guarantee you I will see more than 5 or 6 folks with active acute psychiatric conditions, many of which will be in the hallway waiting for hours for services, perhaps days, right? And this has only been exacerbated in the context of the COVID-19 pandemic. And so we need more resources. We need to really fight for more parity when it comes to mental health. But this is all going on within the context of a mental health crisis, and I think we need to be acting with urgency.
Thank you for that. And I was almost going to not belabor, but go a little bit deeper. Where is the correlation between what you see and the benefit that maybe these patients can, with the mentor, go for a walk, do some projects, correlate what you just named and how the Waterfront or the Coalition of Green and Blue Spaces can help address that?
Well, I think it's much more than just the ability of being able to walk to Waterfront, right, and to exercise,
Yep.
and maybe get some time off, burn some calories. There's an issue of exclusivity as well, right? When people don't feel welcome to enter a certain space, that's not good for their mental health, for their well-being. And so opening up these spaces, allowing people to come in there, feel welcome, being proactive from the other side, getting people to come out there and share in these spaces, I think that's where the real healing takes place. And that's what I'm hopeful about. I mean, a couple of weeks ago, I knew this organization was legit when I was walking in Roxbury with my child at a basketball tournament, and I saw the folks from your organization here handing out surveys, getting our information. And I was so pleased to see that, something I'd never seen before. And so it really speaks volumes of your organization and the work that you're doing, and it gives me hope for a better Boston and a better Commonwealth.
Thank you. I wanted to say that both you and Pastor Willie set me up to, and Pastor Bodrick, I'm sorry. You talked about the historical context, and we've named that. We've set a good foundation as to why we got here. I want to spend sort of the second half and ask you, and I heard I think it was Latifah, the moderator before me, talk about a wand. If you had a magic wand, or if you had the full power of God to just, what does inclusion look like in the context of what we've been talking about? And Dr. Ina, I'd start with you.
Yeah.
You all couldn't hear her, but she
Yeah.
said, So
That's
you know
so
something's coming when she said,
I think, if I had a magic wand, I think it would be, every person in Boston has this, it's just the sense that they feel happy here. They feel like there's a community here, right? Like, I think one of the things the pandemic made very clear was that we cannot be isolated humans, right? We go crazy in social isolation. That's why solitary confinement is like one of the worst punishments that a human can go through, right? And so the idea of that, instead of having all these parallel lives that are occurring, right? Everyone goes to their apartment, goes to work, and just we travel in our own spaces and parallel each other. Where are the cross sections, right? Where are the places that we can meet? And in a space like what you guys are trying to create, not just meet, but have conversations, talk about our histories, partake in different activities. And that, I think the sense of community is absolutely rooted, or absolutely roots a person's sense of mental health and sense of belonging in a place. And then for me personally, just having that magic wand would be every patient has, every community member, every patient has access to whatever medical treatments they want, that insurance will cover it. They don't have
Both
to worry.
Western
Both
and-
Western and Chinese medicine, and whatever works for them, right? And of course, there needs to be regulation around safety, because there are, of course, unfortunately people out there that will take advantage of patients that are more vulnerable, right? And so having safety regulations, but then, just patients being able to use and have access to whatever treatments work for them. If they say acupuncture works for them, then having the Western doctor believe in them and say, all right, I'll support you in that. But having a sense of community and then access to all sorts of medicines that are safe. Yeah.
Jenn, in your perfect world, in the context of the waterfront and green spaces and mental health and healthy, what does that look like? Y'all better get ready. What does that look like?
I mean, I don't know. I feel a little bit like the magic wand question is a bit of a cop-out.
Okay.
Because it's like, well, if we all had the resources we all wanted, sure, so much would change. Okay. But I can tell you a list of 5 things that are pretty tangible that I think would be solid
So
next
no magic
steps.
wand, but reality based on?
I mean, I don't think they're gonna happen in the next 5 years. So I think there's still some magic there. But I think something super simple, the harbor walk and the pathways from the streets to the waterfront? Are they paved in a way that like you could get there on crutches or in a wheelchair? Like I tried it out this year. It was interesting. Like I didn't fall, but it was still really hard work and I needed like a whole other person, right? So something like where you walk. People in the past panel talked about signage, right? Like signage is crucial for being able to understand where you are, what you can do. And something that has been a really historic problem is that, one, you probably don't even have bilingual signage. But two, if you do, it's only telling you, don't fish, don't walk your dog, like don't do this thing. So then bilingual signage is only bilingual, and then it's just a list of things you can't do, right? That's obviously a big issue for so many people, right? It shouldn't be in 2 languages. Boston is so diverse. Transportation as well, right? Like if I had a magic wand, we could have a perfect T, we could have an orange line, right? We could move Logan Airport, like, just kidding. But there's so many things with transportation where if you didn't have to make as many transfers from Roxbury, right, to be able to get to Long Wharf, right, to visit the aquarium or go to the ICA, that would make it so much more, you could be more inclusive because people could actually get there. And then I think really a magic wand related to inclusivity on the waterfront. I think that over and over again, the conversations I have with people in communities or right on the waterfront is like, we want programming and we want it consistently. We want to know what's going to happen. We want to know like who is providing it. And we want it to be there like every week during the whole summer. And we want like 4 seasons of programs. And currently that's just something that, you know, I think all of the organizations who are represented here are working really hard to make that happen. But there's just so many spaces where, you know, whether it's the funds or the weather or the structures, they aren't there so that we can't actually have that type of consistent programming.
I would say at least 3 of those may not require a magic wand, a pen, legislation, and budget, but and good segue into our representative rep. Speak either to it from a policy perspective. I mean, you can come at it from a few perspectives. Policy in your role in civics, and then also because of your work, you get to see the impact of when things aren't equitable. But I'm sure there have been some times where you and a case manager or nurse have made things equitable. So from a policy and your familiarity with, you know, healthcare and treating patients, what does a full inclusive waterfront, Boston, but maybe focus on that green and blue space down there, what does it look like for you?
To me, I mean, for my patients and my constituents, and as someone who spent time growing up on Ruthin Street in Roxbury, it's really a sense of belonging, that the whole city is my city, that I can go anywhere across this entire city, from West Roxbury to South Boston, from East Boston to Charlestown, to JP, and feel like I belong in this city. And for better or worse, and many times worse in this city, given the historical context, people don't feel like that, right? There's isolation, there's gentrification, and as a result, there's health outcomes from that. In the district that I represent, that goes from Copley Square all the way down to Roxbury, parts of BMC, there's a 30-year life expectancy difference. 30 years in a 15, 20-minute walk. And to me, that's scandalous, right? And so when I'm in the emergency department taking care of patients, it's always a reminder of where government has failed us, where our leaders have failed us. And to your point, you've brought up a whole host of great ideas and that many of us would agree with, but it's about tackling the political will, prioritizing these issues. And the State House often say, you know, there are about 6,000 to 7,000 bills introduced every year. And what makes it to the top, right? It's those that have the most influence, the biggest, the largest partnerships. And so when I look at the waterfront, when I look at the intersectionality between the issues that those who are excluded from those spaces are dealing with, right? It's like, how do we develop partnerships with these folks, right? I mean, you go to those communities, whether it's Roxbury, Dorchester, places where I grew up, right? They happen to be poor. They happen to lack the same economic and educational opportunities as well. So how can we partner with these different folks to raise this issue, to amplify these issues in order to have bigger stake when you go to the State House or when you go to City Hall to fight for these resources? Because some of it can be flipped on a dime, right? With a couple signatures, right? But only if you have the political will, and that requires getting the partnership in place. And so that's what I've been fighting for. I'm sure that's what many of us in this audience and on this panel have been fighting for, and look forward to keep on doing that.
Pastor, ideal inclusive, waterfront?
Yeah, I think we're starting at the wrong point, and I think the place where we start this ideal is with the people. That's what we've been doing at TAC. We've engaged over 500 residents, talking about these barriers, engaging them, talking about not only the barriers but also the solutions they want to see. We've been empowering and lifting their voices. So if there's a magic wand, it's to make sure that their voices are here when we have these conferences, their voices are here when we're talking about solutions, that their voices are here when we're talking about policy changes. Like that's the magic wand that we need to see. We have it. It's the people. They're the magic wand. And if we're going to do the work of actually shifting and changing this discourse and really creating, we want to see climate resilient infrastructure. We want to see, spaces that are engaged, and we want to see more programming. We want to use FPA spaces, facilities of public accommodation.
Define FPA.
Facilities of public accommodation. Yeah. Those are spaces that are available and should be used. Developers get this all the time. They have spaces in the area that should be used and could be used for better programming, could be used for business infrastructure, could be used for parallel investments in our communities, but it starts with the people. And so we can get to those issues that Jim brought up. We can get to those policies that just need one signature, as our rep said. We can get to those issues of creating spaces of wellness, like Ina said, but it starts with lifting their voices and making sure that we're not dictating to them, but we're listening to them, that we're lifting them up. And that's the magic wand, is to listen to the people, and we'll be able to find the direction that we need to go. And so I hope that that's where we start. I hope that that's where this engagement goes. That's why we're going to continue to engage residents. We're going to continue to partner with all of our partners to provide the programming, but it actually starts with making sure that their voices are centered, not only in addressing the problems, but also, creating the solutions.
I'm going to come back this way. If someone can tell me just how many more minutes I have left. Programming planning. Jen talked about programming. There's a health wellness programming. There's civic engagement programming. Program planning, what to really have that effective, ongoing, give me some examples. I heard surveys, TAC did surveys, but what are some other, and not diminishing them, but what are some other unique and different ways? Because folks have been doing surveys for years, and folks still don't feel included, generally speaking. And so what's one other thing that really would get people to participate in the program planning? The waterfront that's why we're having these conversations. There's something going, thank you. There's something going on that the trustees or someone said, hey, there's an opportunity that maybe wasn't presented years ago. And so what are some other ways that people from the community can inform programming and planning, not just for programming, structures? I heard someone say in a formal panel, and Chief White Hammond said this at our event at the ICA, that you design spaces that can be fun for young people, green space or whatever, and then they serve as a sponge. If there's, we're in a harbor city and climate change is very interesting. And so how do we get the people to come out and participate in that programming and planning, development? How do we do it uniquely so people are really feeling engaged and the people that are approaching them are authentic? Well, that's something you can't make up. That has to come from a sort of heart place, but everything else. Generous question again.
I think we're doing that work, right? When we engage residents, when we talk to them, when we do program, when we partner, one of the best things that we do is like, how did you experience this? Like, what was good, what was bad? Somebody say, we didn't have to have it there. You could have just told us. If you just told us this, we would have been there. And I was like, oh, well, we didn't know that, right? And I think for us to be receptive, that just because we're bringing resources, all those other things, that we're not always right. And I think there's what I would call sort of an epistemic humility that you must approach all your work with in order to actually engage and humanize the work that we're doing, because there are people who might have better ideas than we do. Some of the other things that, our goal is to actually have somebody from our community lead our waterfront work, we want to hire somebody from the community. We're not looking for somebody with some great credentials. We want somebody who's actually experienced the program, who saw the benefit of it, and we have money ready to hire whoever. So if there's somebody who wants a job,
I was just
please,
getting ready to say
please,
announcement
please.
there, announcement.
We're hiring at the American City Coalition because, we want the people who are helping to shape and form the future of this to lead this work. And that comes out of our community. And so I believe that if we're going to do this work effectively, we need to be in constant communication with people. We need to have feedback. We do focus groups. We do all of those different things. So, and this work has been happening for us since 2018. So we're not new to this. So we've built a community of people who come. That's why we can have over 800 signatures and registrants for a boat ride, or have over 500 people that want to come to do kayaking. It's because we have a community we built, and that community is strong and much due to this team in Charlotte and all the folks who've been doing this, and all of us, even last week we were out there on the water, right? And I brought my son, and it was a good time, and it was a beautiful thing. And so I think being more than present, continue to be in constant. It's not going to happen overnight, but if we're consistent and if we come to the work with humility, I think we'll drive this a lot further than where we are right now. And being willing to come to make the accommodations that we need to do to make sure, as partners, we come to the table in good faith and ensure that we're executing on behalf of the people.
Right.
Well, it's important, I think, that we frame this correctly. And I agree with your comments, Pastor Bodrick, with respect to the wand. We have the wand. We know what the wand is, right? There was once a famous physician who said, listen to the patient, they will give you the diagnosis, right? Surveys are just tools. Focus groups are just tools. But the real learning, the real engagement starts with listening. And that's how I approach my medical practice. That's how I approach my work in the circles that I do as a representative. And so I think you can have as many surveys as you want, as many focus groups as you want, but unless you allow these people to lead, work with them. When I was a community organizer for a couple of years as a Peace Corps volunteer, I remember going into my community, and it was a poor Haitian immigrant community in the Dominican Republic, no running water, no electricity, and I was, had a task to build latrines essentially. So I came in there with, a couple $1,000 that I was able to secure and some resources, and one day we had a first community meeting to build these latrines, and I, sent this notice out, spoke to folks in the community. The day of the initiative, no one showed up, right? Because no one felt empowered. No one felt like this was their project, right? And so when we start creating interventions, whether it's access to the waterfront or better access to healthcare, mental health, and allowing people and patients to lead the fight and feel empowered by that, that's where the real change starts. And that's what I think we should be focused on.
The people allowed them to listen to them. There's some learning in that, and lead. There's this old adage I used to hear that it was listen, learn, then lead. So the people listen, learn, let them lead.
Add one more L, love.
That's the first thing. Let that be talking to the pastor. Let that be the foundational thing. Yes, sir. So love, listen, because love, listen, learn, lead. You got two preachers boxed in here. Jenn, what programming and planning, and you talked a lot about programming, but build upon what Pastor and the reps said. I know you can't. Go ahead.
No, it's all good. Okay, how many of you have been to Moakley Park? Wow, that's so many hands. That's so exciting. Okay, so I'm just going to do an example. Okay. So Moakley Park is under redevelopment with the city of Boston, right? It's 60 acres. It's waterfront property. It's where flooding is going to occur. It's going to impact thousands of people, especially in public housing. So this is a space where the city has said, the Parks and Rec Department has said, we should have a more extensive community engagement process, right? We want to understand what the people who live here want from this huge space in the redevelopment. But just like so many people have said, there's lots of tools we can use that we think are great ideas, right? And they can be, depending on the situation. But it doesn't necessarily mean that what you want to use is going to be the best fit for a community. So for example, I think that a lot of us are online, right? And we very frequently use social media to get information out about events, right? Educational things. Take this survey, let us know what you want. In a lot of spaces, that's just not effective, right? Especially in areas where, right behind Moakley Park, there's Mary Ellen McCormick, which is historically the largest and oldest in New England of public housing. And that's a space where I have spent hundreds of hours in the last 15 months. And something I've learned, just we were talking about with listening, is that you have to go and listen. And you need to go with the community member because you probably really shouldn't talk, right? I am not a South Boston resident. I am hoping to be able to listen, learn information, be able to report it to the city in a way that then has all of that information wrapped up in the redevelopment, right? And so a couple different tools that I've used for that this year and worked with partners on. One is interactive surveys, right? Words can be overwhelming, right? Words are not always accessible, right? You might not be able to read, they might be big words, like all of those things. So one thing we worked with the city on is having like little dots that were colorful dots that you could put like what your favorite thing on a page was. Like, do you want educational signage? Do you want an art exhibit at the park? And like kids from 3 to like 90, right? All like gave their input by looking at pictures, being explained verbally, and then doing that. And then we calculated all that information, all those dots turned into data points, and like the changes for phase 1 incorporated that feedback, right? So that's one way that you can sort of use a survey plus more, right? Like a little bit more. Another is like walking around the community on Friday evenings, right? Getting to go with a community organizer and leader and listen to what families and individuals have to say. Whether or not it's because you have an event in 2 days and you literally want to bring the information to people, not assume that people should come to you, or whether or not you are just like looking to understand the people you are working with and seeking to serve. So I think listening and receiving information back in ways that is like most effective for the people takes time. It's a little bit like a puzzle piece, and you have to be really committed to continuing to show up and adjusting what you wanted and your expectations so that you can actually hear people. Because if people know you only want to receive certain information or only want it in a certain way, there's no reason for them to share, right? That is just like people being used. And I think that one of my like core tenets as a community organizer is that I never ever want a person to feel like they owe me information. I just want to be there and feel incredibly honored if people share, because it shouldn't be transactional. It should be relational.
Love the people, listen, learn, and lead, engage and liaise in authenticity. That's what I'm hearing so far. Dr.
Not yet. Not
Ina,
yet.
You get to close us out.
No, this is such an honor to be here and to hear all of your thoughts. Actually, just to build quite directly on what you were saying, I kind of think about it in like a 3-step process, and I start with step 3, which is you need to build trust, right? Like so much of this is about building trust. And how do you build trust? You show up. Whether it's it's raining or snowing and you're like, oh, I'm too tired, I don't want to do it. You still go and show up. Even if one person comes, that's success. I think redefining what success means in community work is really, really important. It's not about reaching hundreds and thousands of people.
Can I just interject?
Yeah.
Because that one person,
Yeah.
the word will get out in the community. Girl, it was snowing and raining, and she still came.
Exactly.
That will spread better than any flyer any day. I'm sorry, because I
exactly.
imagine that scenario
Exactly.
and somebody sitting there and they sending out text. She really showed up. She came.
Yeah,
Sorry.
Exactly. No, exactly. And one of the pop-up clinics that we do here is really modeled after work that I was doing out in Oakland a couple years ago, where it started with this clinic called Freedom Community Clinic. And it was the founder, who's now a doctor, and me. I was her little intern for a summer. And it was just the two of us like popping up in different places, like talking to students, working with maybe 3 students over the summer. That was in 2019. And now she sees about 2,000 patients every month and through this pop-up model. And like we were so happy just to work with 3 students over a summer. And then so that's step 3 is build trust. Step 2 is show up. And step 1, which is the most important one, that Dr. Small, the person that I work with, the Panthered physician, he always says you have to develop yourself as a human. Are you a good person? Are you kind? Do you show up for your family? If you're going to show up for your community, you should know how to show up for your family too. Show up for your friends. Are you healthy yourself? Right, and that's a hard thing, right, for us. But that's something I see a lot in the healthcare system, where doctors are so overworked, and yet we're supposed to be telling our patients, you should be exercising, you should be eating well. who are we to say that if we can't model that? But beyond that, it's not just healthy like physically, but healthy mentally, right? Are you taking the time to go to therapy or go to have a support system? Because if you don't develop yourself, you can't sustain that work. One of the reasons why I'm studying history is because I feel like we have so much to learn from people. Dr. Small is now 80 years old and he still works. He semi-retired, but then was like, no, I got to go back to the people. I got to keep working. And he can do that because he's done the self-work and self-development for over his entire life, right? He has those practices, has those social support. So yeah, I think like the number one thing is, are you a good person? And if you're, I mean, everyone is innately, right? But making sure that you're developing those parts are so important. Yeah.
I'm going to try to do a synopsis of what programming and planning looks like. So the foundation, be in love. You respect and value the people. You learn, listen, and allow them to lead through authentic relationships. I forgot that. Authentic relationships, and then also being authentic to yourself at the foundation. Love yourself, to circle it back. Love yourself enough that if you love your community, you'll love yourself to be there for your community. Let's give them a hand. We have a couple of questions, but let's give them a hand. Thank you all so much for being a part of this. We only have a couple of minutes, and I have two questions, one from social media and one from someone that had to leave. The first one, and we can't have everybody reply to this because I want to stay in time. If you have friends that have never been to the waterfront, maybe I'll throw this to Jenn. Where should I tell them, or where would you tell them to go if they've never been? What's the one place you would tell them to visit on the waterfront?
That's so hard. I guess, like, if you want the best sunset on the waterfront, you have to go to Pierce Park. Where's Alex? It's, like, right by the sailing center. But I sort of feel like any waterfront is good waterfront. So if you get to the one that's closest to you and you've never been before, then I'm so excited. Like, that's great. Like, a gold star.
Good answer. No, thank you, because I think I'm going to stay in time. This one is a little bit of a longer one. How to dismantle cultural barriers when wanting to engage with communities that are often left out, not invited to the conversation. So we did sort of already address that. Personal example, family is from Haiti and bottled water is critical to health in Haiti. When people come to the U.S., how do we dismantle those lived experience that can be harmful to the environment? Do I need to repeat that again, or can someone, Pastor, I see you. Yep. So a family comes in from Haiti, and bottled water is crucial to health in Haiti. When people come to the U.S., how do we dismantle those lived experiences that can be harmful to the environment? And so I don't want to put words in your mouth, but maybe the bottled water or putting the plastic back in the community, in the environment?
Yeah. Well, I think, one of the things that we should do is not treat any community like a monolith. We start there and recognize that even within Roxbury, Dorchester, Mattapan, wherever you are in the city, even within communities, there are drastic differences within people, experiences, how they come into the space, how they come into the waterfront, how they come into the work. And so I think one of the things is it starts with the work of like saying, look, who are we dealing with? Have we built the relationships to get to know, what this community, what this family, what this person has experienced to actually honor their reality? And if that is, understanding the trauma of coming from a space where, health is contingent upon this, we should actually try to find ways to build accommodations for each and every person, each and every community, and acknowledge that there may be differences, which takes a little bit of work on our part to do the learning, right? And to be patient, to recognize, and also know we might not always get it right every time, but we're going to continue to work towards bettering our processes and procedures each and every time we do work and do programming. It's also reaching out to folks that you wouldn't traditionally reach out to, right? And saying, look, hey, welcome to the country. this is for you as well. And making sure that they feel welcomed and feel encouraged, and hopefully be able to ask questions and feel comfortable enough to talk to us to say, look, this is an experience that we have, and it's hard for me to kind of overcome this reality. How can we work together to work, to make them feel as comfortable as they possibly can, and hopefully encourage those who are there to feel as if the waterfront is there for them as well. So, I think that's the work that we have to do, the hard work of us as partners, to make sure that we're doing the real engagement work to get to know that there are nuances and there are delicacies, like we have to be delicate with a lot of different things that we should be delicate with, and knowing that if we do that, we'll see the returns of people saying, "Love what." They welcome us, they understand us, they get us, and have them help inform how we do it. I think that's so important. Like having community inform our practices, hopefully will inform the ways in which we engage as well as inform the outcomes that we see.
Let's give them a hand again. This is just, I'm really full by the notion and understanding that what we're doing now is we're really saving the lives of people in this city and a couple of generations from now, because this conversation about including everyone, especially Black and brown folks, understanding climate change and the environment. Someone said that, that area by Moakley Park, it wasn't soon, it's going to be, you were very confident, it's going to flood, and so being here today, all the coalition and everybody and folks that are doing, it is really setting us up to save the lives of the next generation. And so you being here today is a testimony to that, because if we do this right, especially with the notion of the sponge absorbing down there and prepare, and the mental health impact and the physical impact, it's not that far-fetched that that's what we're doing. So thank you all for being here. Anthony, I believe, is going to come out and give us our next set of directions.
Thank you all. Can we give it up one more time again for our panelists?